The effects of watching pornography on the brain are a topic of ongoing scientific research, and there is still much debate and varying viewpoints among experts. While it is challenging to provide a comprehensive answer due to the complexity and diversity of research findings, I can discuss some general points that have emerged from studies on this topic. It is important to note that individual responses to pornography can vary, and not all people will have the same experience or outcomes. Brain activation. Research using neuroimaging techniques, such as functional magnetic resonance imaging, fMRI, has shown that watching pornography can activate brain regions associated with reward, pleasure, and arousal. This includes areas like the nucleus accumbens, amygdala, and prefrontal cortex. The release of dopamine, a neurotransmitter associated with pleasure and reward, is also observed during sexual stimulation. Desensitization and tolerance. Some studies suggest that repeated exposure to explicit sexual content may lead to desensitization, where individuals may require more extreme or novel material to experience the same level of arousal or satisfaction. This has been observed in studies on the effects of prolonged exposure to violent pornography, where individuals may become desensitized to aggression and develop more callous attitudes towards others. However, the extent and long-term consequences of desensitization are still debated. Impacts on relationships and sexual satisfaction. Some research has explored the potential association between pornography use and relationship satisfaction. Findings are mixed, with some studies suggesting a negative impact on relationship quality and sexual satisfaction, while others report no significant effects. It is important to note that causality is challenging to establish in these studies, as other factors, such as individual differences and relationship dynamics, can also influence these outcomes. Addiction and compulsive behavior. There is ongoing debate regarding whether excessive pornography consumption can lead to addiction or compulsive behavior. While some individuals report experiencing negative consequences in their daily lives and relationships due to excessive pornography use, the concept of porn addiction is not yet recognized as a formal diagnosis in the Diagnostic and Statistical Manual of Mental Disorders (DSM-5), which is widely used by mental health professionals. It is essential to approach this topic with nuance and consider that not everyone who consumes pornography will experience negative effects. Factors such as individual susceptibility, pre-existing conditions, and overall patterns of use can influence the impact it has on an individual. If you have concerns about your own pornography consumption or its effects, it is advisable to consult with a healthcare professional or therapist who can provide personalized guidance and support.